Oral Health Part 1. How the CDC's Oral Health Strategic Plan will address national oral health concerns. First, let's talk about what the CDC's Oral Health Strategic Plan actually is. The CDC's Oral Health Program is a component of the National Center for Chronic Disease Prevention and Health Promotion. Beginning in 2001, the program was state-based and offered financial backing and technical assistance to oral health and disease prevention programs within the state. In addition, the CDC's Oral Health Program aids states in collecting and reporting data regarding the status of oral disease within the state. The program has grown substantially over the past 15 years and is instrumental in data collection, infection control guidelines, and the development of guidelines for the use of fluoride. Today, the mission of the CDC's Oral Health Program is as follows: to prevent and control oral diseases and conditions by building the knowledge, tools, and networks that promote healthy behaviors and effective public health practices and programs. This is an ambitious goal. Let's take a look at how the CDC Oral Health Program plans to accomplish this mission in its 2011 to 2014 strategic plan. These plans are created in accordance with public health priorities as determined by CDC leadership, federal agencies, and stakeholders, and is published every 3 to 5 years. There are currently 8 goals in the strategic plan. First, dental caries or tooth decay, periodontal or gum disease, mouth and throat cancers, infection control, dental public health infrastructure, elimination of health disparities in health policy, translation and dissemination of CDC products and policies, and organizational capacity and function. By focusing on these 8 core areas and functions, the CDC Oral Health Strategic Plan aims to achieve its goal of preventing and controlling oral diseases. But what are the oral diseases threatening the health of our nation? An oral health report issued by the U.S. Surgeon General, Dr. David Satcher, through the U.S. Public Health Service and Department of Health and Human Services, found the following conditions to be the most prevalent in America: dental caries and periodontal disease, microbial infections or infections resulting from bacteria and viruses such as herpes, oral conditions resulting from tobacco or alcohol use such as mouth and throat cancer, and inherited or congenital diseases. Of these, dental caries or tooth decay appear to be the most concerning. 60 to 90% of school-aged children have some sort of tooth decay, as do the majority of adults in America. So now we know what the major oral health concerns that are threatening our country are, and we know what the strategic plan will target. But let's take a look at what the CDC will be doing specifically to target these issues. Beginning with dental caries, the strategic plan aims to strengthen national and state-based surveillance, which will lead to the development of evidence-based health promotion programs. To address periodontal disease, the CDC plans to work with the American Academy of Periodontology to develop and validate self-reported measures of periodontal diseases, which will be used for surveillance purposes and screening tools. Next, to help combat the continued threat of mouth and throat cancer, the CDC plans to compile data consisting of proven effective strategies and interventions in order to improve early detection. The fourth goal, infection control, focuses on producing evidence-based infection control guidelines. By outlining, guiding, and monitoring infection control standards in dental hygiene, the CDC aims to cease the spread of microbial infections. Next, the CDC plans to review the impact reform dental public health infrastructure has had on dental health promotion programs. An increase in effectiveness and efficiency in these programs will provide a case for further investment and continued improvement. The sixth goal, eliminate health disparities or inequalities in health outcomes and treatments, can be achieved through the continued monitoring of these disparities and by educating policymakers and health professionals alike on the need for equal health services. Next, the CDC aims to increase the capacity of the oral health program and to further disseminate their guidelines. To do this, the strategic plan calls for policy-relevant research, partnership development, and promotion of evidence-based science. Finally, to accomplish the 8th goal of having an efficient and effective organization, the strategic plan focuses on cultivating both internal and external partnerships, workforce development, and an emphasis on enhancing the internal organization structure. So, as you can see, the CDC Oral Health Strategic Plan acknowledges the current and most prevalent threats to oral health in America and has developed a comprehensive plan to tackle these threats and improve the lives of Americans everywhere. Through its implementation, the 2011 and 2014 Strategic Plan will effectively work towards completing its mission of preventing the spread of oral diseases.